Most welcome in pharma military. My self name is Manoj Rathore and professionally I am pharmacist. Today I come with a topic, the Widal slide test, in which I explain you principles, procedure and normal value of Widal test. With the help of this video, you can understand the normal value of Widal test. Let's start. It's a serological method used to detect antibodies against Salmonella species, particularly Salmonella typhi and Salmonella paratyphi. Both are responsible for typhoid and paratyphoid fevers. My dear friends, Widal test is a serological method in which detect antibodies against Salmonella species, particularly Salmonella typhi and Salmonella paratyphi. Both are responsible for typhoid and paratyphoid fever. Principle of Widal test. This test based on agglutination reactions between antibodies and antigen. This Widal test based on antigen-antibody reactions and form agglutination or clumping. When we see the agglutinations, it means result positive, and we don't see the agglutinations, then test result is negative. When specific antibodies are present in serum, they bind to the antigens of Salmonella bacteria, leading to visible clumping. When specific antibodies are present in serum of patient, they bind to the antigens of Salmonella bacteria and give the visible clumping, and it show the test result positive. If we don't get visible clumping, then test result is negative. When a person is infected with Salmonella, immune system produce antibodies against the bacteria's antigen. It is a natural phenomena. Whenever we injured or infected, our immune system produce antibodies against the pathogens, and antibodies kill or remove those pathogens from our body. In the test, patient serum is mixed with non-antigens. The primary antigens are used in Widal test: O antigen, somatic antigen of Salmonella typhi; H antigen, flagellar antigen of the Salmonella typhi; AH antigen, flagellar antigen of Salmonella paratyphi A; BH antigen, flagellar antigen of Salmonella paratyphi B. Mostly used antigens in Widal test. Process of Widal slide method. I explain you briefly. First of all, blood sample of patient taken, and blood sample stand for some time for clotting. After clotting, with the help of centrifugation method, plasma means serum separated out. After it, on the glass slide, circle labeled with O, H, AH, BH, NC, PC. In this, put a drop of serum in this labeled circle and add one drop of antigen suspension in these circle corresponding. Clear? And mix it with applicator. After it, glass slide rocks for 1 minute. Meanwhile, this antigen antibody reaction completed, and B, see the agglutination like these agglutination in this. There are also present, but there is no agglutination, means there is no antibodies in this serum. And observation, positive result of Widal test. When visible agglutination or clumping form, it indicates the presence of antibodies against the corresponding Salmonella antigen. Means Widal test based on agglutination due to the reaction between antigen and antibody. When agglutination form, it means positive result. If visible agglutination not form, it means negative result, means in the serum no antibodies present. Clear? Interpretation of elevated titers. Widal test, which is involved in analyzing the antibodies titers against Salmonella antigen to diagnose of typhoid or paratyphoid fever. My dear friends, Widal test, which analyze the antibodies which is present in serum of patient against the Salmonella antigens to diagnose typhoid fever or paratyphoid fever. The test measures agglutination's reaction to specific antigen. This test measures the agglutination reaction to specific antigen, means this test based on antigen antibody reactions and which form the agglutinations, and main criteria is measuring of agglutination. Understanding titer values. The titers are expressed as ratio like 1:80, indicating the dilution level at which antibodies are still detectable. Higher titers suggest a stronger antibody presence. My dear friends, titers are expressed as a ratio which indicate the dilution level at which antibodies are still detectable. Higher titers suggest a stronger antibody presence. And to diagnose properly, expert will include titers ranging from 1 raised to 20, 1 raised to 40, 1 raised to 60, 1 raised to 80, 1 raised to 160, and 1 raised to 200, and presents a typhoid test report. Expert in daily routine, they use these types ranging of titer value, and report also present in this form. So please don't confuse. It is a titer value expressed in ratio form in which antibodies is detectable. Clear? This is very important part of this video. Please concentrate your mind on this point. I will try to explain you in briefly. That's why you can understand Widal test report easily, negative or normal. O antigen titer less than 1 raised to 80 and O antigen titers less than 1 raised to 160 means typically no active infection. Clear? O antigen titer less than 1 raised to 80 and antigen H titer less than 1 raised to 160. It is a normal value, means no any infection. Clear? Second, borderline means O antigen titer 1 raised to 80 and H antigen titer 1 raised to 160 means may require further evaluation. It is a borderline level, so need further Widal test for confirmation. Next, positive. When O antigen titer equal or more than 1 raised to 160 and antigen H titer equal or more than 1 raised to 160. Clear? It means current or recent infection. We can understand when titer volume equal or more than 1 raised to 160, either O antigen or H antigen, it means positive report it, and we can understand that it is a current or recent infection of typhoid parasite. Please watch again this table. There are some factors which may affect Widal test results. In this timing, antibodies typically become detectable 7 to 14 days after infection onset, making early diagnosis challenging. Antibody typically become detectable 7 to 14 days after infection onset. If you perform diagnosis test before actual timing, then result may be challenging. Cross-reactivity. Previous infection, vaccinations to related bacteria can lead to false positive result. If you suffering from any infections or vaccination to typhoid or paratyphoid bacteria, it can give you false result. So keep your mind, if you are suffering from an infection or vaccination, please avoid Widal test for accurate results. Endemic areas. In regions where typhoid fever is common, baseline antibodies level may be elevated, complicating result interpretation. A single Widal test may not provide conclusive result, so another Widal test may be performed after 7 to 10 days. So confirmation of typhoid fever, those are some limitations which affect the Widal test result. Please like and share my video. Thanks for watching.